France. From your expert opinion, how do you view the proposals put forward by the French government?
Well, I think it's a very good proposal. It corresponds to many of the proposals that have been made. I'm very pleased to see that there is certainly room for interpretation in what I've seen and what I've heard. Like, for example, the possibility to make it different in different parts of France, which is absolutely vital. And this is very, very important because this epidemic, and now it's a pandemic, as you know, is very different in the very different regions. So in fact, when you say France or when you say Switzerland, you should really talk about the different part of the country, because they are really under a burden that would be completely different from one region to another. I've seen in the plan that the recommendation is for not moving from one department to another as much as possible, which is something that is very, very good, that makes sense, that deserves a lot of expertise to be recognized. Opening of the school makes sense, in particular starting with the very young children, and this makes real sense to do it that way. And I guess that, of course, there are fine-tunings that are necessary, as always. And honestly, I think that this is a good plan, of course, as very well recognized by the government. As far as I understand, the numbers still have to go down. We are talking about a day which is 11th of May, so it's like almost 2 weeks from now, so it's not now. And this is also very important. And of course, according to some of the numbers, some of the decision may still be modified or changed a little bit, but the plan makes sense to me.
And Monsieur Pittet, a lot has been talked about. The French Prime Minister Edouard Philippe talked a lot about protecting the population. And one of the parameters that has been brought up in France and in Europe is the app Stop COVID. Is the medical community behind enforcing such an app, especially on a voluntary basis, to help alleviate the pressure, perhaps, off medical staff in treating COVID-19 patients?
Well, I don't know if in treating COVID patients, but in managing, there is difference between treating patients and managing patients. It's clear that these kind of app, there are several apps that are available, as you know, but this would really facilitate the handling. As nicely reported by this report, the anticipation is that there will still be, at the time of deconfinement, or let's say on the 11th of May, there will still be between 1,000 and 3,000 COVID patients to identify, diagnose, catch, and actually quarantine. So this type of apps would be mostly useful in this very difficult time, where looking for the contact between a case or a potential case and the surrounding people would be really, really the key for success of the decontainment phase. And if we want to succeed, we need to maximize our chances to recognize who are the people in contact with whom who have become recently COVID+. So this type of application would certainly be extremely useful in the handling of this very specific situation.
And finally, Monsieur Pittet, you were saying before that you were quite pleased at the fact that the government was giving themselves margin on how they were going to address the issue in the coming weeks. Edouard Philippe outlined phases. The first phase would be from the 11th of May to the 2nd of June, and then from the 2nd of June onwards. Do you believe that 3 weeks will be enough to have a good perspective of the situation?
2 to 3 weeks is exactly what we need to interpret the epidemiologic curve. So this is exactly what we need, because as you know, let's assume today you will be in contact with a positive patient. You will get on average 5 days to get the first symptoms, and then 10 days to be hospitalized with the disease. So this is exactly what we need. We need between 2 weeks and 3 weeks to interpret the results on the epidemiologic curve. So it makes sense to go by steps that goes from 2 to 3 weeks to 2 to 3 weeks, if you like. And this is very, very important. So to me, it makes a lot of sense. It simply say that Edouard Philippe was certainly guided by very good experts that provided him with expertise that makes sense. And this is a decision that goes with the epidemiology of the disease when you are able to follow up the disease.
One final aspect that Edouard Philippe spoke about was, of course, the use of technology, the e-commerce, and in particular in relation to masks, the fact that masks will be made available for the general public in May, but that they won't be distributed, or the variety of methods to distribute masks to the general public will vary according to regions and, of course, the geography of the territory. How critical would you say it is for French people, for people everywhere, in fact, to get masks as quickly as possible to help protect them?
Now, we need to be very, very careful about the concept of the use of masks, because as you know, what is the most important is social distancing, hand hygiene, keep people as much as possible, for those who can continue to work at home, because you want to reduce the population density in movement. Then the mask would only be used in conditions where you cannot keep this social distancing. And of course, if you go in a public transport, the first thing that we need to have is increasing the cadence of the public transport to reduce the density. Then, if the density is too high, yes, once you are closer from 1 meter to another person, you may have to use a mask. So it's clear that the mask, on the long term, everyone should have, if I can say that, a mask in his pocket in case it's needed. But you should not make the mask universal masking strategy, because the universal masking strategy has dangers. The dangers are that you poorly recognize the conditions where you have to behave well, keep the social distancing, keep hand hygiene being strong. And once you wear a mask, you have to clean your hands before, you have to adjust your mask, so have your hands coming to your face. And all this time are time period at risk for you to actually auto-infect yourself. So I think that, yes, a strategy should be in place for every French person to find the mask when needed, but it doesn't mean that you have to actually supply masks everywhere at every corner of France. You have to be understanding, people have to understand that they have to live with some degree of uncertainty and use the mask only when appropriate.
Didier Pittet, the director of the Infection Control Program at the University of Geneva Hospitals, thank you ever so much for those clarifications and for joining us live on the program. Thank you.